All right. Well, I'd like to welcome everyone back to the brain injury discussion. This is your host, Jay. Today, we're going to talk a little bit about sodium and brain injury and how you can get a brain injury from too much or too little sodium, and also what role does it play, not only in the renal system, but also how it pertains to the brain. Like always, sources will be in the description below. I would also encourage you to look those up. Feel free to give us a like, maybe comment down below if there's something interesting that you've learned. And feel free to subscribe to this channel. We try to put out this content every week and cover a topic that maybe we encounter. Maybe a new topic, maybe something that's unknown, and it gives us an opportunity to learn and also to teach. So, with that being said, let's get started into sodium and brain injury. So, what do we know about sodium and how does this pertain to the brain? Well, number one, it is one of the crucial electrolytes. Electrolytes also include stuff like potassium, which is notated by K. We're also talking calcium, things that you would find in your food, or you might see something like vitamin D's and all that. We're talking about the mineral sides. We're talking about minerals like sodium, potassium, calcium, phosphorus. There's other ones in the body like magnesium, but that list can go on, and that could be a video in and of itself. And we do know that sodium is very common in medications. It's also common in food that we eat, the seasonings that we put in the food, like we see here in this photograph. And it's also common in IV fluids. You ever heard of anyone say on a TV show, hang normal saline? Normal saline is just, clean salt water, sterilized salt water. So that's all saline is. But there's different kinds and gradients of the salination to those waters. So that could be a very big difference there. And we see that sodium helps regulate fluid volumes in the body. So again, there's different locations of fluid in the tissues. They're either inside the tissues, in between the tissues, or outside of the tissues. We also see that there's fluid in the blood that is in the vasculature of the body, and that blood carries that nutrient-rich blood, or at least I hope it's nutrients, to the brain via the arteries and back to the heart to be either refilled with oxygen, nutrients, minerals via the veins, in which that is a previous discussion. But this leads us to talk about something called renal function. Renal is the system of filtering the blood, which is primarily the kidneys, and that passes all the unnecessary stuff, the used up stuff, the waste product through the ureters into the bladder, through the urethra, and out the body. And so what we really find is that this is a big conversation about renal function and how it connects to the brain, and sodium has a big role to play in that, as well as cardiac function. So you do need sodium to maintain that balance to make sure your heart is doing well, as well as the blood pressure. Blood pressure is controlled by how much fluid is in the body, as well as other things like it's the pressure that is around the arteries. And so when you see the two numbers, one is the artery at full contraction, the other one is at full rest, and we'll cover that in another video. But we also know that sodium is important to homeostasis, which is sweating. Um, so if you are getting hot outside, as we are maybe in the summer, and you're sweating, you're also releasing some of that sodium, but it also helps release some of that fluid from the body. So that is a general overview. Again, this is just a very basic understanding of sodium and how it interacts with the human body and the brain. So with that being said, let's look into a low sodium state, which is called hyponatremia. And if we break down this word, what we find is again, hypo, we've used that before, it means low. And then sodium levels is natremia. As we can see here via this graphic, sodium is denotated as Na, not So. So it is Na for sodium, and that's kind of a Latin word for natra or natreme. So that is why you get Na for sodium. But hyponatremia, let's go back to that and we'll say, yes, there can be chronic hyponatremia. What if someone sweats a lot and is not recovering that um, sodium content? Maybe they're overhydrating, maybe. But it can also be acute, which is probably the more severe type, and that's the information I got. Hyponatremia was something I learned in field medicine school, where this would happen after someone does not intake a lot of sodium. Again, sodium, you'll probably hear people say, lower your salt content. Again, consult a doctor before you start changing your diet. But it could be from low sodium intake. Maybe they're not eating enough sodium. Maybe they're not intaking enough sodium. It could also be caused by renal disease. Again, from a young person's point of view, think of rhabdomyolysis, especially in combat medicine, where we start seeing failure of body systems and possibly fluid retention, where you're sweating out the salt. Salt is part of the sweat, where you're sweating out the salt and you're retaining some fluid either by intaking it or maybe you're not expelling it. Maybe an increase in the fluid without the salt. So again, we're increasing the stuff inside the container, or maybe you're decreasing the fluid that's going out. So maybe there is a kidney problem there, which can lead to hyponatremia. And you might be wondering, well, how does this pertain to the brain? Well, we do have this thing called hyponatremic encephalopathy, which um, the source down here has this wonderful organized chart that explains how you get there. Um, but what hyponatremic encephalopathy is, it's a low sodium level that is below normal limits. It leads to fluid increases in the body where it shouldn't be, or maybe too much that is in the body. It leads to neurological dysfunction to include probably the big one here is brain swelling because there's more fluid and you got to pull that fluid away. And that swelling of the brain is what causes the encephalopathy. Again, the acute cases are in fact very severe. And there are also chronic cases of hyponatremic encephalopathy, but most of them are in fact the severe kind, the acute kind, the sudden kind. And it can be fatal. And it can also lead to something like altered mental status or AMS, seizures, or even possibly coma. And what this does is that it will cause blood-brain barrier damage or BBB damage, or it'll lead to something called demyelination, where the myelin sheath of the axon or really the neuron is falling apart. And we talked about that with diffuse axonal injury, where we see demyelination with that. But with that being said, in a nutshell, that is hyponatremic encephalopathy. Well, we've covered low sodium. Maybe we should cover high sodium. And we're going to do that on this next slide. So we have hyponatremia, but we also have hypernatremia. Again, if you intake a lot of this salt, that could be a bad thing just as much as if you don't have enough salt. And it's usually high sodium in the body. And this affects the body regulatory systems, to include the cardiac system. Again, too much is a bad thing. Too low is a bad thing as well. But it also affects the blood and your body fluids, as well as your renal system as well. There's too much of a good thing is a bad thing. And so, what can cause this? Well, maybe you're releasing the fluid either by micturition or by urination or by sweating, and you're losing all that fluid, but maybe you're not losing the salt and to match that percentage. It could be by dehydration. Maybe you've ate a lot of salt and haven't brought the other waters in your body. And so maybe you're excessively urinating. Maybe you're on a medication that makes you urinate a lot. It can also be caused by diabetes and other endocrine disorders, in which we've talked a little bit about how the endocrine system kind of plays in and regulated by the brain. Again, hypernatremia is too much salt, and too much salt is a dangerous thing. And you might be saying, Jay, how does this apply to a brain injury? Well, on this next slide, right here, we have what's called hypernatremic encephalopathy. And this is where you have way too much sodium in your bloodstream, in your body. And what it does is it can lead to what's called cellular shrinkage. So again, this is on a cellular level, kind of like diffuse axonal injury, where it's causing problems on the very smallest of scales, but it's causing problems nonetheless. That is an injury. And what we see is a reduction in brain cell volume. And in extreme cases, again, we are using that terminology, demyelination. Again, having to deal with the axon, having to deal with the myelin sheath. And so we might be talking about those kind of injuries as well. And some of the effects of the severe types, again, this can be a very acute or sudden or very chronic thing. And we can see seizures from this. We can see muscle and motor dysfunction. We can see cognitive deficits as well as motor deficits as well. Um, in severe cases, there can be a coma, and there can also be hemorrhage. A hemorrhage is, in fact, very possible from this. And hemorrhaging is a bad thing, especially in the brain. And so you might be asking, well, Jay, this is a kind of a weird scenario. And you're right, but this is something that does exist and that maybe we should be aware of. There's always brain injuries that we're learning about. So, what does this lead me to conclude as a brain injury case manager? Well, the first is we want to be prepared, and especially if the past medical history indicates something along these lines, this might, be something to think about. All right, if someone does not have enough sodium in their body, maybe we should work towards increasing that sodium with the help of their medical provider, to help guide along that way. Again, a lot of this is due to medical providers, and a lot of this will be interfacing with medical providers. But maybe there is something there that maybe we can help prevent, or maybe help facilitate prevention of this. Also, a big point that I got is here. This is something that is microscopic. It is so small, but yet it can still affect the brain. So, not all brain injuries are big. Blasts from overseas. They're not falls from 14 floors. They're not huge car accidents. Sometimes brain injuries can be on a very small level. This also inspires me to continue learning about anatomy and physiology. Anatomy being study of the body, and the physiology, which is how the body interacts with itself. So again, this should continue our learning. We do need to learn about those two things because the more we know, the more we understand, the better we can better prepare. And even the smallest things can make a difference. And sometimes it's the things we cannot see. And so, with that being said, as a brain injury case manager, I should be aware that these things do exist and I should be able to take these things seriously. And also, this should inspire me to continue learning about these things because it's not just enough to know that a traumatic brain injury can happen. We also need to know about other types of brain injuries. But with that being said, I'm going to wrap it up for this episode. Again, here are my resources. They will be available in the description below. Please do comment. We do love hearing your feedback. And if you have a suggestion for a video, or maybe there's a brain injury I haven't heard of, I would love to research it and make a video out of it. Also, feel free to give us a thumbs up. We enjoy likes. We also enjoy subscriptions. We try to put up this content. We try to make it relatable, but also educational. So, with that being said, I'm going to sign off here, and I hope you all have a wonderful day. And don't forget to protect your brains.